Dental implants are a well-known solution for replacing teeth that are missing, as they are a long-lasting and natural-looking option. There are many different kinds of dental implants that are available, every one with their particular advantages and drawbacks. In this clip, we'll go over the various kinds of dental implants, helping you make an informed choice regarding which type is suitable for your particular dental requirements. 1. Traditional dental implants. The traditional dental implant is the most frequently used kind of implant with the highest success rate, which is up to 98%. They comprise three primary parts: the implant along with the abutment as well as the crown. Implants are surgically inserted within the jawbone. There, it joins with the bone in time to form the foundation that is stable to support the replacement tooth. The abutment, once attached, is bonded to the implant. It acts as a connection between it and the crown, that is the visible component of the tooth replacement. The traditional dental implant is an alternative that is versatile and is able to be utilized for replacing teeth that are missing, individual teeth, or even whole dental arches. They are a natural and sturdy solution that could endure for years with proper upkeep and treatment. 2. Mini dental implants. Mini dental implants tend to be less in diameter than traditional ones. They are commonly utilized in instances in which there's insufficient bone mass to hold a traditional implant. They can be placed by a procedure that is minimally invasive and are a preferred alternative for patients looking to steer clear of more extensive surgeries. Dental implants that are small in size, commonly utilized to strengthen dentures and bridges. They offer an extra secure and comfy suitable fit for the replacement tooth. It is also possible to use them for replacing narrow or small teeth where conventional implants might not work. 3. All-on-4 dental implants. Dental implants that are all-on-4 are a more modern and effective solution to replace an entire arch of teeth by using only 4 implants. This method allows for an immediate installation of a denture fixed on the same day as implant procedure. This gives patients the complete set of functional and natural-looking teeth with just one appointment. Implants that are all-on-4 are great for patients who've lost most or all their teeth and are looking to find a cost-effective and speedy treatment. Utilizing a strategy to place 4 implants on specific angles in the jawbone. This method eliminates the necessity for bone grafting. It also allows the faster and easier recovery. 4. Implant-supported dentures. Implant-supported dental dentures are a kind of denture that is held via dental implants rather than resting on the gums, as with conventional dentures. This can provide more stability and a secure dental implant, which reduces the possibility of slippage and discomfort when eating and talking. Implant-supported dental dentures are either adjustable or fixed, based on the individual's requirements and choice. Dentures are commonly employed to replace many teeth or entire dental arches and increase the functionality as well as the appearance of the mouth. In the end, there are various types of dental implants that are available that each have their particular advantages and drawbacks. No matter if you're missing one tooth or a whole dental arch, there's a dental implant that could help bring back your confidence and smile. You should consult an experienced dentist in order to identify which kind of dental implant is the best to meet your individual desires and needs. When you choose the appropriate treatment and care, implants are able to provide long-lasting, natural-looking solutions for tooth loss.